I plan to finish up with late adulthood today. In this first part, I'm going to do the physical development, finish up physical development, and go through cognitive development. Whatever I don't finish today, Friday, I will move on to death and mourning rituals, and I will leave time in case there are questions for the review for the final. Okay, we're going to see changes in physical development throughout late adulthood, and I've already given those concepts of primary aging versus secondary aging. That some of this is just the aging of a member of the species, and some of this is aging that is because of lifestyle choices and exposure to toxins and chemicals and so forth. And genetics is of course in there as well. And so as I'm going to be making these pretty overarching statements of loss that we're likely to have, I'm going to try not to say this over and over again to save myself time, but there's a great deal of variability between people. And we're going to see, I'm going to try and keep up with mentioning some of the lifestyle choices along here that can help slow a lot of this loss. So one thing we see change is the senses overall. We lose a lot of most of our senses. First, we'll talk about vision. So your author here gives some basic aspects of what's important for our vision. The cornea, which we talked about a little bit before, and the lens, which we talked about in middle adulthood, because that's really what is in presbyopia as we're becoming middle-aged, and it gets harder and harder to see, especially the small words and stuff as they get closer and closer to our face. That is really, it's the lens that can change shape and to accommodate so that we can look at things far away and then change our focus and accommodate and look at things close up. The lens is fattening up there in its curvature. And as we age, those ciliary muscles that are allowing for that weaken, and we also start to see a thickening of the lens. Well, this thickening of the lens, as that kind of continues and there can become a bit of a cloudiness to it, those are called cataracts. And so people tend to be losing their vision. It looks like there's basically cloudiness between their retina and where they're doing the perceiving of the world and what's out in the world. These cataracts are very easily operated on. They can now, in developed nations, just put in a new artificial lens. I've known people who've had surgery for their cataracts, and they went in saying they were pretty depressed that they were losing their vision and that they didn't enjoy movies and so forth as much anymore. They didn't feel comfortable driving. Went in for the surgery, came back out, and they said it was like having new eyes, and it was wonderful. Another thing that can happen as we age is called macular degeneration, which is the degeneration of the macula. And what the macula is that when we are moving our eyes around the world, what we're doing is we are changing what's on our fovea, or where we have our really detailed vision. So when I want to look at words, I'm going to put my foveal vision right on the letters of the word. And right around that fovea is called the macula. And this is where we have a lot of our cones, of those photoreceptors that allow us to see color and allow us to see detail. And those can start to degenerate and just die off. And so if we have macular degeneration, if we lose our sight from macular degeneration, there is nothing we can do about it. However, we can prevent it depending on our genetics, and we can certainly slow it down once we notice it starting. So this can be done with omega-3s. So a lot of people start taking their omega-3s, but you can get omega-3s also from fatty fish like salmon, and those small fish have a lot of good omega-3s in them. So mackerel, anchovies, sardines, all of those. And that will nourish the pigment epithelium, which is what's nourishing or keeping those photoreceptors, those cones, alive. Another thing you want to do is to get your dark green leafy vegetables. So those vegetables have specific micronutrients in them that are helpful for, again, nourishing the pigment epithelium and keeping our photoreceptors alive. And once someone notices it, they can start taking their omega-3s. They can start taking these ocular vitamins that give them the zeaxanthin and the lutein, those micronutrients. But it's better to start before you see the problem, because what you're going to do then is just slow the problem down. Once it starts, you're already where you are. You can't go backwards. Those cones are dead. Okay, glaucoma is another possible problem that people can have. This is a buildup of pressure within the eye, and it can go and damage the optic nerve. And so it's doing the damage kind of from the outside in, and so we tend to lose some of our peripheral vision first. And again, once the damage is done to the optic nerve, there's nothing we can do. Okay, and one thing I didn't say on that last slide, because once I stop, if I have to stop and start again, I learned that it deletes everything. It clears out what I've said. I may have done that a couple times before realizing that. But we can help glaucoma with medicated eye drops, again, if we know that that's happening. And this is why, especially in middle adulthood, but then even more so in late adulthood, we get our eyes checked really often. Okay, and they do all the necessary tests to see if we need to start taking medicated eye drops. Okay, we also see changes in our other senses. So hearing, we tend to see a hearing loss where the structures of the inner ear are becoming less flexible. We have inner hair cells and outer hair cells, and they have these even smaller hair cell looking things coming off of the hair cell, but there's these little tiny, thin, microscopic hair looking things called cilia, and those can be damaged. And as we are damaging more of those, then our inner hair cells and outer hair cells can die off as well. This is more typical for the higher frequency sounds. And so a lot of older adults end out with tinnitus, and tinnitus is a ringing in the ears, and it looks like it's really those areas where we've lost hair cells. That part of the brain is still wants input, and it's not getting any input, and so it's also not getting the negative feedback that we're not hearing anything, and so we start to hear this kind of ringing from those specific frequencies that we lost. We also have a loss of taste and smell. So we don't have a lot of neurogenesis or new neurons being produced and then living throughout our adult lives. We do have some in the olfactory receptor neurons and in the hippocampus, but for a while, as we're aging, we are producing more of those than we are losing. And then some of those that are produced don't come to fruition or don't get enough neurotrophins to survive, but we are producing enough to replace the ones we are losing, and that starts to go in the opposite direction as we get older and older, where we are losing more and more and we're not producing enough to replace them. And so everybody, as we age, is going to also lose those taste cells and olfactory receptor neurons that allow for a good sense of smell. How quickly that happens, as well as what we've already seen with vision and hearing, but especially taste and smell, how quickly that happens depends on whether or not you smoke cigarettes or whether or not you smoke, as you are sometimes taking in these chemicals into those areas and killing off those neurons faster than they can be replenished. And so people who've smoked lose their sense of taste and smell even more so. And they also are more likely to have hearing problems and vision problems, but it's not as clear as the problems with taste and smell. But especially, I think it's cataracts are especially influenced by smoking as well. We see changes in sleep patterns where they are spending more time in stage 1 sleep. They spend less time in stage 4 sleep, where our brain is really getting the quality rest that it needs from the day, where neurons are synchronized and firing together, but then not firing all together at the same time, which looks to be when we're really resting our brains. And we also see a decrease in REM sleep. Both of these are the stages of sleep that help us with laying down new memories, which might show us why we have some of the cognitive decline that we see as we're getting into late adulthood. They also develop a morningness. If you remember, we had a real clear indication that we had an eveningness when we were in late adolescence, early emerging adulthood, and then we saw this kind of, if you remember the figure, that we see this kind of drifting back towards a kind of morningness where we're getting less sleep and we want to go to sleep earlier. But this becomes even more clear with people saying things like, the morning is my best time as we get into late adulthood. And often they're saying, I really don't like the evenings, I'm tired. We also see sleep apnea as being common. He talks about that here. I guess I had forgotten that as we were moving through because I talked about it in middle adulthood. I might have even referred to it in young adulthood, but sleep apnea becomes more common now, even though I think of it as we're starting to see the problems often in middle adulthood, but even more likely now. Some of these changes and some of our lack of sleep that can occur in late adulthood, they're often due to psychological and medical conditions. So one thing we tend to have is worse circulation, and so we see people are more likely to have this kind of restless leg problem, which wakes them up at night. We also see a shrinking bladder in men and women, but men are more likely to have to get up and have to urinate in the middle of the night, as they also have an enlarging prostate. It's pushing up against that bladder. We also see psychological problems of anything having to do with depression or anxiety, that those continue to be problems, and we are more likely to have some of that occurring in late adulthood. We can start to see some chronic health problems in late adulthood. Some of these may have started in middle adulthood and are continuing on, but they're even more likely to start happening in late adulthood. The first is arthritis, that pain in the joints that can just be a pain just when we're sitting or sitting too long, or it can be a pain when we're trying to use our muscles and really our joints. It's the cartilage between the joints is wearing away with use, and we're also starting to lose the fluid in there as well. That can be a nice shock absorber. It is really important to do muscle strengthening exercises to help with arthritis. And women tend to have arthritis more often than men, and overweight people tend to have more arthritis than people who are of a healthy weight. And again, exercise helps. Now I mentioned osteoporosis in middle adulthood, and I went through some of why we're losing that bone mass, and especially in women as they're losing the estrogen through menopause. But osteoporosis is, again, it's more likely as we get older, and it's more likely in women. And we do see that shrinkage in both men and women, but we see more shrinkage in women as we're losing some of the bone mass in our spine. Now, your author talks about how something like 15% of women over the age of 65, once they have some kind of fractured bone, they are likely to die within a year. And osteoporosis makes it more and more likely that we are going to break a bone when we fall or stub our toe or whatever. So if we can, taking calcium helps a great deal. And again, staying healthy in the way that we eat helps a great deal as well. Another possibility in late adulthood is hypertension. So as our heart is getting more rigid and it is not pumping blood as efficiently as it used to, if we are continuing to eat fatty foods and we are building up the plaque in our arteries, we have more likelihood of having hypertension and dying of some kind of coronary heart problem. Arnett estimates 70% of adults over the age of 65 have hypertension. And this is another one of those things that smoking is particularly harmful for us. It's doing some damage to those arteries. He talks a little bit about healthcare and health promotion, and I know a lot of this sounds like repeating, but diet and exercise. Diet and exercise are really important, and especially as we get older and people become less and less likely to do it. If I have something like arthritis, it can be painful to start an exercise program, and yet exercise is going to be the thing that helps me to deter or to slow down the problems with arthritis. So it's kind of important to start earlier than late adulthood to get into good habits for one thing, but also to sort of build up some of the abilities that we need. He has a lot of specific nutrients. I can't remember them all listed under diet, but definitely B6, B12. Some people start taking vitamin D as they get older. I'm going to again say the omega-3 fatty acids are really important. Protein is really important. And because of changes in hormones and changes in taste buds and so forth, people who in their late adulthood can really stop enjoying food. And so whether they're taking some kind of vitamin, it's a good idea to take a vitamin, but getting some of your nutrients from real food is really important as well. He talks a little bit about automobile driving here, and he actually tells a story on his father. I'll tell a different story on my father. My father did not want to give up his license, and that's pretty typical. As one of the studies he tells us is how we see that people who give up their licenses are more likely to become somewhat depressed after that, as they're losing their independence. And so giving up your license is really difficult. My father didn't give up his license until he was put into an assisted living area because he was falling down, and so he needed someone to watch him. He was 85 years old, and he insisted on keeping his car still. He wasn't going to give up the idea of driving, and so he was the only person other than the workers parked because there were only 6 patients, and he wasn't going to give up his car. I went to visit him. I reconnected with him after 30 years of not seeing him. I reconnected with him as he was put in assisted living, and it was the first time he was really settled somewhere. And they told me not to let him drive. He begged me to let him drive. I let him drive. He was going to go to the grocery store. We were just going to stay in the area. And he got on the highway. And it was so frightening that I put in my regular instinctual what I do, like when I've been on the Autobahn with friends or whatever, and they're freaking me out by when I'm watching the road, it's scaring me. I just close my eyes and pretend I'm asleep and tell them I have to not watch. And I sat there and thought, this could be the way I die. Dad cannot drive this car. And he did not tell me he was going to get on the highway, and he should not have been on a highway. It is a really difficult thing. He tells a very kind of similar story on his father. It's a very difficult thing to get them to give up their driving, and they can become more depressed because they have lost their independence and their ability to take care of themselves in ways that they've gotten really, really used to. Arnett also discusses damage from smoking, which now I've talked about several times. I think I might talk about 1 or 2 more times. Can't remember. And heavy drinking. So having a drink or two a night, or really a drink a night or a drink or two every other night or so, that is not a problem at all. And in fact, a drink of red wine, they say, a night is quite good for you. But heavy drinking, binge drinking, drinking more than a couple drinks every night is problematic and can do damage not only to our physical system, but the physical system of the brain as well. As we'll see, it has some cognitive outcomes in addition to influencing our health. Some of what I've talked about as far as getting micronutrients and omega-3s and all of that, if you are drinking alcohol, I can't remember which classes I've said this in, but if you're drinking a lot of alcohol, you're closing up the villi in the intestines, and you're not taking in the nutrients that you need to take in. And you can even take a vitamin pill, and it's just not getting through it's not being absorbed into your system. And so heavy drinking is also problematic, and I'm sure I'll mention it again in cognitive development. And a healthy lifestyle doesn't just lengthen life expectancy, it extends a person's active lifespan. This is the number of years when when physical functioning is favorable enough that people can enjoy their lives and perform their daily activities without impairment, but also enjoy and go out and enjoy aspects of their lives. The author estimates that active lifespan is about 50 years old in developing nations. They are not as likely to, they don't have the medical support for living much beyond 50, but even if they are living much beyond 50, they have all the problems that, like cataracts and things that we can help people with that they cannot. And living a healthy lifestyle helps you to maintain those activities of daily living and maintain your abilities to do the things you want, from cognitive, anything cognitive, as well as physical, as well as getting back into exercise or dancing or any of those other physical activities that we might want to do. As we see cognitive development, again, as I'm talking about declines, these vary widely between people, but we're going to see some decline in selective attention. We usually do the Stroop demo here. We've already talked about selective attention a little bit, but if you know the Stroop task, if you're seeing the word red and it is in the font color of blue, you want to name the font color of blue, but it's very difficult because the word red is right there and you read it and you have to actually inhibit that irrelevant information so that you can say blue. This gets harder for older adults. It's hard if you have ADHD. I've turned 50 and I have ADHD, so I definitely have a hard time with the Stroop task. I never do it in front of my class, but you might get a really good laugh if you saw me try. We see a decline in divided attention, so being able to multitask or take in two sources of information at the same time. I usually call it or talk about it as task switching, that when we are switching back and forth, we are missing something of the one task. We're really scheduling our attention back and forth. The people who do it most don't appear to be aware that they are missing information, or else they're just more impulsive because they're the worst at it. But we also lose this ability as we age. We also see a decline in sustained attention. So doing the same task over and over again, someone in the some air traffic controller, they're going to have to be paying attention to the same task for a sustained amount of time. And this gets more and more difficult as we go into late adulthood and as we get older. Those attentional abilities are related to, but aren't exactly the same as fluid intelligence. We've talked about fluid intelligence before as the speed of processing information, and especially kind of visual information and putting it together. We see a decline in fluid intelligence. We see a decline in working memory, which I sometimes think of as really overlapping a great deal with those attentional tasks of what can I keep in memory while I am switching attention or while I'm maintaining this kind of sustained attention. But they're all related, but not the same thing. But we see a decline in working memory. We see a decline in episodic memory, where they are not laying down new memories as well as they used to. And so they don't have the memory for those events quite as well as they used to. And even when we're looking back on old autobiographical memory, so I sometimes talk about episodic memory as the episodes of our life, but it's really the autobiographical memory. Research on that autobiographical memory notices that there is a reminiscence bump. Okay, and I can't remember the exact ages your author has in there, but it's around 19 to 30 years old, about, where there's some suggestion that this is when we are having a lot of firsts, we are moving out, we are having our first relationships, we are getting married, we are going to college, we're changing things, and so we might remember things better. But it's clear that we have this reminiscence bump for historical events as well, that there are aspects of our memory that at those ages are just at their peak, and that we're laying that information down much better than we're going to ever again. We see a decline in source memory, which is the memory for what source did I see that information in, or who did I hear that from. So did I read this in an academic journal? Did I read this in a textbook, or did I hear that on Oprah? Is usually my example for that, because it's really important for me as I get older to know where I heard information. So it becomes more important for me. I actually stay away from anything that might give me false information because I'm afraid I might forget the source. I also used to know which textbook and where I could find specific research. I still have some cookbooks that I know where to go for a particular recipe. But as I've gotten older, I've noticed this loss, and I mark things more, but it doesn't help the way it's not as good as memory. It's never as good as memory. And unfortunately, that's going to get even worse as I get older. There's no real decline in procedural memory. And in fact, they did some research looking at training on a particular task and whether people learned it in their 20s and 30s or learned it in their late adulthood. When they brought them back to do that task, the people in their late adulthood did just as well. So something where we are practicing using our muscle memory and learning something of that nature is an example of procedural memory. I'm pretty sure the task they used was about muscle memory. It was screwing a particular cap off and moving it a certain way. But procedural memory can be learning patterns in visual stimuli, or learning the patterns of the world, and that's a more cognitive process. And that does not appear to decline. And in fact, we're building more and more of that as we are aging. There's also not a decline in semantic memory. If we are remembering that Abraham Lincoln is the 16th president and we have that semantic memory or that semantic space, there's not a decline in that. And again, in fact, we have been building that knowledge representation throughout our lives. And so that is getting stronger, not weaker.